Thank you so much, Mr. Chairman. This investigation has been bipartisan, and as you mentioned, it was a year ago today when we sent our first letters to 3 of the drug wholesale distributors before us today. Those letters described the devastation of the opioid crisis, and they referenced a report that over 6 years, distributors showered the state with 780 million hydrocodone and oxycodone pills, while 1,728 West Virginians fatally overdosed on those 2 painkillers. Over the last year, we learned a lot more about the full scope of the epidemic in West Virginia. As the chairman said, we obtained data showing that pharmacies in tiny towns received millions of pills in just a few years. But our work is not finished. We want to know what these companies knew about the rise of the opioid epidemic, when they knew it, and whether it informed their distribution practices. In fact, over a decade ago, the DEA sent letters to all registered distributors informing them that, quote, the abuse of controlled prescription drugs is a serious and growing health problem in this country, end quote. In 2007, CDC reported that drug overdose deaths nationwide increased by 276% between 1999 and 2004. And in West Virginia, drug overdose deaths were up by 550%. A well-publicized 2008 JAMA study specifically implicated prescription opioids in the rise of overdose deaths. In 2010, the New England Journal of Medicine article, A Flood of Opioids, A Rising Tide of Deaths, showed that the prescription opioids death toll continued to rise, particularly in West Virginia. In 2011, the Charleston Gazette published a major story describing how residents began calling the town of Williamson, quote, Pilliamson, because so many opioids had flooded that town. And this is just a small sampling of the articles that highlighted the rise of this epidemic. So yet, even as this information was coming out, it appears that over 3 years, distributors sent more than 11 million pills to one pharmacy in a town of 400, and more than 12 million total pills to 2 pharmacies in a town of 3,000. I mean, come on. I know we're going to hear from the distributors that they had systems in place and that they only fill orders by pharmacies that hold valid DEA licenses. At the end of the day, however, I think we can all agree whatever systems were in place did not prevent damage to these communities caused by what appears to be the excessive supply of opioid pills. Some of the counties that have been the focus of the investigation have the highest death and overdose rates in the nation. The epidemic has devastated families throughout that state, and it's placed huge burdens on the state's health care system, its child welfare program, and its economy as a whole. Now, we need to understand the root causes of how we let this happen and why distributors apparently supplied so many opioids to certain small-town pharmacies. For example, how did the tiny town of Kermit, with a population of 400, receive 9 million pills in just 2 years? Shouldn't the distributors' suspicious order systems have immediately flagged and halted shipments of this magnitude? And shouldn't the distributors have examined them more closely to determine the appropriateness for shipping them? I also want to understand why major drug companies failed to have adequate suspicious order reporting programs in place and were forced to have to settle with the DOJ and the DEA, not once, but twice during this epidemic. Do the distributors believe that any of their suspicious order reporting system failed? And if so, how? I hope what we learned today will help us inform investigations all across the country, including in Colorado, which has had similar concerns raised about overdistribution. Mr. Chairman, let me conclude by saying we agree it's critical that we understand what happened and how the nation has found itself in the grip of this opioid crisis. But at the same time, I think that the overall committee needs to make sure that we have adequate resources available to help those in need and to get people like those in the hard-hit places we'll be talking about today, the recovery that they need. As we look back on what happened, We cannot turn our backs on those who were devastated by this crisis. Thank you, and I yield back.